Hi, this is the first of a series of weblogs about burnout and other stress-related disorders. Burnout is a nasty thing. This is because how you feel, but also because of the fact that the world around you does not understand you anymore. More so, you even do not understand yourself. You do not understand what's happening. In this series of weblogs, I want to explain what burnout is all about, how you can deal with it, and how you can show your surroundings how they can help you. The title of this first weblog is Burnout and the Lack of Our Medical Model. Burnout is rising, is increasing. In the Netherlands, between 10 and 20% of the working population is suffering by some kind of burnout. And even people of young age are affected. There has been a lot of research now about burnout, but the fun thing is that they know who are suffering from burnout, but they do not know what burnout actually is. There's no definition. Burnout is not a real medical diagnosis, and they are still doing a lot of research about it. Most of the time, burnout is called a psychosocial, work-related disorder. But if you are dealing with people with burnout, like I do, then you notice that a lot of the symptoms are physical. People are complaining about tiredness, fatigue. They are complaining about tension in their muscles. They are complaining about pressure on the chest or a blur, or they are having heartbeats or problems with their breathing or belly pain. So there are a lot of the symptoms are physical. Of course, there are mental and emotional problems as well. And because they seem so dominant, people tend to focus on these mental and emotional problems, which is not helpful in the long term. You also have to deal with the physical problems, more so because the underlying problem of a burnout and most of the stress-related disorders is a biological dysregulation. And this physical dysregulation does not disappear when you stop working. So when you stop working and you think, now I can take my rest, then these problems, or a lot of these problems, tend to remain. The problems and the physical kind of these problems tend to lead their own life. And because of your feelings, you get more stressed or more depressed. You start worrying, or you keep worrying. And this is how you keep on going, having burnout problems. Burnout problems with this underlying dysregulation of your nervous system, of your hormone system, even of your immune system. So as I told you, there's not really a diagnosis burnout. There's no medical profession who has a burnout in their medical handbook as a diagnosis. Some of them will call it a depression, or will call it an anxiety disorder. Other ones will call it hyperventilation. These are more common diagnoses. But the underlying thing is that it's not typical a mental thing, emotional thing, or a physical thing. It's a psychosomatic disorder. And now we have a problem because the medical professions are divided in people who are focusing on the psychological part, and other ones are focused on the physical part. So which specialist should you attend? Your GP, he will say it's harmless and you should take a rest and maybe have some pills. When you go to a psychiatrist, a shrink, or a psychotherapist, they will focus on the emotional problems, which they should, and they can help you with this. While the worrying is also a function of your nerves. There's too much restlessness in your nerves. Well, I will explain all these symptoms in later weblogs, but the emotional kind and the worrying is only one part of your problem if you have burnout. Well, you can go to a physical therapist, and he or she will focus on your tensions in your body, the muscle tensions, or maybe on your breathing pattern, and this can be very helpful also. No? If you're lucky, you will find somebody who recognizes and acknowledges that this is a psychosomatic disorder which needs a broad attention for the whole spectrum of symptoms and the underlying dysregulation. And this person can help you with one of these dysregulation and send you to somebody else to help you with another part of your disorder. Or, but this is rarely people who can help you with a lot of these symptoms. Nowadays, you can find on the internet a lot of people who offering you to help with your burnout. And a lot of these people have suffered a burnout themselves. And they also can be of some help because they recognize and acknowledge your disorders. But a lot of them don't have any medical background, so they cannot help you precisely with like breathing pattern recovery or stop you with your worrying. So this is what you must accept. It's difficult to find a very good help, and the main thing is that you should help yourself. Recognize the problems with yourself, acknowledge and accept. And this is what we are going to do in the videos, which are still to come.